During the period of summer 2011 through fall 2011, I took assessment, diagnosis and intervention, lifespan development, individual analysis, and brief solutions. Assessment, diagnosis, and intervention was a very informative class for me. I learned all about the Diagnostic and Statistical Manual of Mental Disorders, which clinicians call the DSM-4 for short. In fact, we read the entire book that semester, and let me just tell you, that was no small feat. This class gave me an in-depth view as to what types of mental illnesses exist and what I should expect from the clients that have these mental illnesses. This class helped me to sharpen my clinical judgment by teaching me the established diagnostic criteria for mental and emotional disorders, by helping me to see the relevance of potential biases of commonly used diagnostic tools with multicultural populations. I think that taking this class and using the DSM-4 as our textbook really helped me as a clinician. We did countless case studies in this class. This consisted of reading clients' background information, then identifying all of their problems, accurately diagnosing them based on the criteria set forth in the DSM-4, and devising a treatment plan for them. This class was invaluable because it allowed me to learn and become more comfortable with the DSM-4. As students, one thing that we all found was that we really had to look at the client's symptoms and closely compare them to criteria for several different diagnoses in the DSM-4, because many of the diagnoses were so similar that they could very easily be confused, which could result in a misdiagnosis. In lifespan development, I learned about the different stages of development that an individual goes through within their lifetime. I also learned about theories of individual and family development and transition across the lifespan, and theories of learning and personality development. In addition, I learned about human behavior and situational and environmental factors that affect both normal and abnormal behavior, as well as strategies for promoting human growth and development. All of this is important because as a professional, I will need to take all of these things into consideration when I'm working with clients, because all of these things could affect clients' thoughts, opinions, attitudes, and behaviors. One major assignment for this class was to do a personal development profile, which is posted on this page. I had to interview significant people in my life and write a comprehensive profile of my development based on those interviews and my own personal reflection. This basically described my physical, emotional, cognitive, educational, and social factors and events that influenced my growth and development throughout my early and middle childhood, adolescence, and young adulthood. I learned a lot about myself that I did not know as I did this paper. As an individual, it made me see that we all have a story, an experience, and that these stories and experiences make us who we are. More importantly, it helped me to see that life truly is a process and that we each have our own, and that as a professional, that must be taken into consideration when working with clients. This theme is something that has resounded throughout this whole program for me. I have to respect each individual client's process. Individual analysis was basically a study of psychoeducational testing. I learned about theoretical and historical perspectives of assessment, test design and construction, appraisal methods, validity and reliability, as well as techniques for selecting, administering, scoring, and interpreting assessment instruments. We also got an overview of testing as it relates to ability and intelligence, aptitude, achievement and personality, career and employment, and development. I have to honestly say that I really did not enjoy this class. I struggled in this class, not because it was difficult, but because the content was just not interesting to me. I also really didn't think that it was very relevant to me either as a clinical mental health practitioner. It seemed to me that this class was more for counselors who would be in an educational setting. I had to work through my attitude and resistance to wanting to read or learn this information during this class. One way that I worked through it was by doing the shadow interview assignment, which is posted on this page. This assignment was to interview a professional who did assessments. I shadowed a career services director at a local college. Doing that interview made the class a little more interesting and definitely made me as a counselor value the importance of testing. I could definitely see how beneficial career assessments would be to a career counselor, and how it could also be beneficial to me as a clinical mental health counselor if one of my patients needed help with work-related issues. In Brief Solutions, I learned brief solutions models and interviewing strategies to help clients resolve issues quickly. This class focused on 3 models. They were motivational interviewing, solution-focused brief therapy, and cognitive behavioral therapy. I liked all 3 of these models, and as a professional, I found that I tend to use techniques from each of them depending on the client. I do a lot of normalizing, affirming, asking for clients' permission to discuss certain things, eliciting change talk, and using the readiness ruler to determine the client's readiness to change. These are all techniques of motivational interviewing. When I work with clients, I usually ask them what their future would look like if their problem no longer existed. This is called the miracle question. I also use scaling questions and look for exceptions to their problems. These are all techniques used in solution-focused brief therapy. Albert Ellis's Rational Emotive Behavior Therapy, or REBT as we call it, is probably my favorite therapy model. I like it so much because it disputes irrational beliefs, and truth be told, most people have irrational beliefs. In addition to disputing irrational beliefs, I also use other techniques like shame attacking, masturbation, and homework with clients. I'm particularly fond of brief solutions therapy because I believe that it is encouraging to the clients to be able to walk away from each session and feel as though something was accomplished, even if it's one small thing. It has been my experience that clients view the counseling sessions and process as being more effective when using brief therapy models. As I did interviews in this class with my classmates, I found that it was very difficult for me to not just tell the clients what I wanted them to do. I found that sometimes I was too forceful in trying to push them to get where they needed to be. I think that I was just too impatient. I definitely was not respecting the client's process. I just had to tell myself that it was the client and it was all about the client and not about me, and that helped me to get through.